Welcome to UPG Pathshala on the subject Social Medicine and Community Health. I am Professor Vidya-mitra, working in the Department of Community Medicine at Institute of Medical Sciences, Banaras Hindu University, Varanasi, and I shall be discussing the module Innovations for Provision of Healthcare in India. This module belongs to the paper Healthcare Delivery System. As we all know that since the inception of planning process in this country, health has received due priority, and health was considered as a significant input for socio-economic development, and healthcare services were developed in a phased manner. And in spite of the fact that we have very extensive network of primary health centers, sub-centers, community health centers in the rural area, and innovations are taking place in the urban areas in terms of provision of healthcare, particularly in the slums, on the basis of vulnerability analysis. However, our results were not commensurate with the promises that were made, and there were serious gaps in the promise and performance. Therefore, it becomes important to review what has happened, and probably in the traditional manner in which we are working, we will not get in the desired things. It is often said that if you are working the same way, you will be getting the same thing what you are getting. So, unless you change the methods, methodologies, thinking process, values, ideas, and so on, probably you will be not able to get the better dividends. And therefore, innovations for provision of health care becomes of paramount importance. That is why it becomes imperative for each learner to understand what innovations are and why they should be done and what implications they have in terms of provision of health care. Not only in India, innovations are required in all fields, but certainly health is one thing where infrastructure reforms and where changing the routine way of working may probably give evidence. This module is contributed by a team comprising of myself as principal investigator, Dr. Nizam Khalik of Department of Community Medicine, Jawaharlal Nehru Medical College, Legal Muslim University, Leader, Clinical Coordinator, and content writer is Dr. Tabassum Nawab of Department of Community Medicine, Jain Medical College, Aligarh Muslim University, Aligarh, and content reviewer is Professor Nizam Khalik of the Department of Community Medicine, Jawaharlal Nehru Medical College, Aligarh Muslim University, Aligarh. As I said earlier, keeping in the mind what the importance of innovations in healthcare, some of the learning objectives that have been set for this module is: what is innovation? About telemedicine, about health management information system, about social insurance schemes, an overview, and public-private partnership. Telemedicine, health management information system, social health insurance scheme, and public-private partnership. These are some of the major innovations that have taken place in the field of health. In fact, innovations got its momentum when National Health Mission was launched, and several types of newer innovative ideas were floated, and it was found that they were quite successful in provision of literacy, civil health, sexual health, and so on. So, it becomes important that anybody who is involved with the healthcare, he should use newer approaches, newer methodologies, and and to understand their importance in provision of healthcare. There are many definitions of innovations, but the National Knowledge Commission defines innovation as a process to achieve measurable value enhancement. So, in any commercial activity, through introduction of new or improved goods, services, operational or organizational process. The point which National Knowledge Commission has tried to emphasize upon that innovations are concerned with measurable value enhancement. Measurable value enhancement in any activity and approaches that could be improved goods, improved services, improved thoughts, improved ideas, improved operational and organizational processes. The following diagram represents a comprehensive idea of various innovations currently applied in the provision of healthcare in India. Innovations in healthcare provision, and this can be classified depending on the level of care. Primary health care and secondary health care. Primary health care primarily deals with sub-centers, primary health centers, and secondary health care deals with community health centers, sub-regional hospitals, and district hospitals. In primary health care, the three important innovative approaches. One is use of telemedicine, second is healthcare information systems, third is hospital on wheels or mobile health services. There are three important innovations that have been used. Telemedicine has its own implications in terms of transfer of knowledge, transfer of technology, and transfer of our approaches to patient care. Health information systems tells us precisely where we stand in terms of primary health care, and this also gives us the identifies the gap between what we should achieve and what has been achieved. Health information system gives critical areas of concern where managers have enough information to plan their activities. And hospitals and wheels or mobile health services are important for those areas where services cannot be delivered on a continuum basis. So these three approaches, particularly these are mentioned, although many innovations have been tried. Secondary healthcare level, telemedicine and community health insurance schemes are quite important uh, and and application of telemedicine improves the quality and output of the health, health services provided at secondary healthcare level. And community health insurance scheme gives the protection from financial protection, social protection, and so on. So just now we have discussed the importance of telemedicine in provision of healthcare and other telecommunication technologies that can help in provision of better health services to the masses in the remotest corner of India. So, an attempt can be made through this approach that the person in the last line, last in the queue, can get the benefit of the health services. Telemedicine has the potential advantage of enhancing the skills of the health professionals. Telemedicine has the potential advantage of technology transfer. Telemedicine has the potential advantage that the expertise can be brought to the periphery through use of telecommunication technologies. Government of India is very serious on this issue that telemedicine should be brought, uh, services should be brought at the each and every medical college, district level, and to the periphery. Apollo 11 is the first, 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 11 is the MIND line is a psychological telecounseling helpline to support individuals who are dealing with complications faced in everyday life. We all agree that in the present era, mental health is a serious problem. A lot of stress, lot of anxiety, frustration, depression are mounting day by day because of many social factors operating in these lives. And therefore, counseling of individuals, particularly the telecounseling helpline by Apollo, can support those individuals who are facing various sorts of complications in everyday life. It is predicted that by year 2020, mental health will be have a very significant concern. And in mental health, counseling plays a very vital role. And therefore, the efforts by Apollo, my underline, in form of psychological counseling is commendable. However, there are many serious issues that how it was reached to the masses, how people understand and internalize the whole process, and because unless there is a mutual dialogue, many issues may not be resolved. Sehat Sathi is a rural telemedicine system developed by Media Lab Asia Research Hub at Kanpur. And it is a mobile-based primary healthcare system for rural India. Now, Sehat Sathi can provide has the potential of transforming key message to the rural masses. If these, because one thing is very noticing that mobile phones have penetrated the whole society, be rural, be urban, and so on. And it can be a potential tool of education. And if key messages are given from time to time, this will help us in enhancing the knowledge of the or awareness in the rural masses, the urban masses, and once they are made aware and they understand the importance of that, it is likely to bring behavioral change in them. So, Sehat Sathi, Apollo, Mindline, and other users, particularly telemedicine, are important inputs which can inputs in the form and innovations that can improve the performance of the health system. The second important area that requires the innovative approach is health management information system. In India, particularly, if you look at the periphery, time immemorial, several registers were maintained. There was no linkages between these registers. There was duplication of work. A lot of time was wasted in just recording the data. And people are going to record the data without understanding its implications in terms of provision of health care. And therefore, it becomes important that those who are producing data, that data should be converted into information. Raw data is raw data. But if it is converted in a meaningful way, so that the manager can take a decision. Say, for example, the number of tubectomy or vasectomy done in a particular primary health center is not enough. What is important that what was the supposed to be done in that particular period and how much it has been done. If you take a percentage of that, then it helps the manager to decide that where this primary health center stands in terms of performance. So health management information system talks of two important issues. One, whatever data is generated at different levels of care, that has to be transformed in such a way that it provides different information to the managers to take for decision purposes. And one of the major innovations that have been done in India is having a integrated, unified system of health management in the country. And health management information system has a very significant concern, is a very significant tool for management for and provides significant input for provision of better health services. Health management information system is defined as a tool which helps in gathering, aggregating, analyzing, and then using the information generated by taking actions to improve performance of the health system. The basic motto is performance of health system should be improved, and that requires information. It is often said that a manager, the best manager is who is well informed, and probably nothing can be more informative to a manager than having an efficient health management information system. Some of the innovations in health management information system is e-Mamata scheme. E-Mamata is a major initiative in this regard. The Health and Family Welfare Department of Government of Gujarat has introduced a mother and child name-based tracking information management system called e-Mamata in collaboration with National Informatics Center, Gujarat. So tracking of mother and children can be a very significant input for provision of efficient reproductive and child health services in this country. So tracking system not only for mother and child, even for the family planning. If the individual couple are followed on the basis of e-tracking mechanisms, then we can find out who are the those couples where unmet need is there, and they can be taken on priority basis. The system of e-Mamata aims at registering individual pregnant mothers, individual children in the age group of 0 to 6 years, and adolescents, along with their full details to ensure delivery of various services. E-Mamata Mother and Child Tracking web-based application is uniquely designed management tool being executed in government healthcare facility across Gujarat to accommodate for gaps in ensuring comprehensive maternal and child health services in rural as well as urban areas. Daily, around 100 auto-generated SMS are sent to the pregnant women and families of children to remind for due services. It reminds each beneficiary that what services are due. And that SMS facility for interdepartmental coordination is such that the chief district medical officer, block health officer, and medical officer can communicate through SMS service to the field workers. So not only this approach brings out messages, gives them, reminds them about the services to be availed, it also provides a platform where managerial decisions can be coordinated at different levels of care. Customized SMS for each beneficiary according to their due dates of services, a new paradigm. It is a greater part of innovations, use of mobile phones, use of SMS facilities in provision of medical care is certainly important, but in the arena of reproductive child health, it has immense potential. Bilingual Gujarati and English SMS on uptake of antenatal services, anemia services, immunization, delivery, family planning, postnatal care are sent to the target beneficiary or their family relatives in each group before their due dates. Unfortunately, if you analyze the data or if you analyze the scenario that prevailed in previous years, that if a beneficiary was not coming to take a particular service, many health workers were not aware that the beneficiary has not come. barring few programs like tuberculosis, where an efficient mechanism was there, but majority of cases, particularly in the case of maternal child health, such tracking was missing. And that was the reason that even people, those who are coming to the like first services, they have not come for the second or they have not come for the third. So there are the potential reasons could be two. One, either nobody has told them to come for the second service or third service, or it is also possible that the experience of first service was not satisfying, and that's why the person has not come for second and third services. So continuum of care is one, quality of service is the second issue, and third issue is that people should be well informed that what is due to them. Because you work in a system, our memory is such that once a reminder comes, then people become more alert. And this, in the era of technology, in the era of telecommunication, use of SMS facilities and customized means tailored SMS services should not to beneficiary to overburden. They should be just be reminded of immediate concerns or immediate benefits that has to be taken by them, and in that way they can be benefited. Uh, this type of approach is different from overloading the information, because if you are just providing the information, many people do not take it. But once you tell that these are the things that has to be done for you immediately, or you have to avail these services immediately, probably this will work. Finally, the services are aggregated to generate reports that are reliable and valid. The point is that use of technology, use of or use of efficient management models and system will provide reliable and valid data. Unless we have reliable and valid data, probably we cannot serve the community in a better way. The URL for MCS tracking system is http e-mamta xxx in LinkedIn, and anybody can approach to that. Mobile health services, that is the second part of the innovations, is that many times it so happens that static centers, many people don't reach to those facilities. And in order to reach to the unreached, we have to take care that health services are brought to the doorstep of the people. Or there may be certain geographical areas where services cannot be provided on continuum basis because of drought, because of flood, because of any other natural calamities. So mobile health services become not only a supplementary activity, but mobile health becomes an integral part of the provision of health services in those areas. Even many people in the community, many people are working community, and if services are brought near to the field, near to the workplace, people will come forward and they'll be willing to utilize these services. The innovations in the area of provision of mobile health services in India is commendable, and many people are now able to avail services through mobile health clinics. Use of medical mobile units to increase reach of medical care in such remote areas is also part of an innovations, because reaching the unreached has been a very common problem, and one of the innovative ways that this issue has been tackled is provision of mobile health services. One of the examples, the Akha boat initiative in Assam, the mobile boat services, the Akha, also known as the Boat of Hope, a fully equipped medical ship. When the great Brahmaputra River floods each year, millions of residents living on its roughly 3,000 riverine islands are cut off from the rest of India. When without the annual floods, poverty and isolation often prevent many Icelanders from seeking medical assistance on these mainlands. And therefore, this innovative in Assam could have uh, been considered one of the significant innovations, and that has made a difference. Pyramidal Foundation's last project, Health Management Research Institute, as I said earlier, has been very innovative. And besides this, social health insurance schemes has been a number of schemes are there to provide social protection to the people in terms of medical catastrophes. Not only in medical catastrophes, but in to take care of medical care as a whole. Unfortunately, in many developed countries, social insurance schemes like the major provider of health care. But as far as India is concerned, in protection of the population through social insurance scheme is not more than 10%. And government of India is fully conscious that unless we initiate a mechanism of community health insurance to take care of BPL people and for removing their out-of-pocket expenses, probably no government is doing justice. So community health insurance is one of the models for providing health security for the people below poverty line and removing out-of-pocket expenses for catastrophic health care. And for that purpose, Rashtriya Swasthya Bima Yojana has been initiated. Rashtriya Swasthya Bima Yojana, this was launched on October 1. The objective of this scheme is to provide insurance cover to below poverty line households from major health shocks that involve hospitalization. BPL families are entitled to more than 700 inpatient medical procedures with a cost of up to 30,000 per annum for a nominal registration fee of rupees. Initial registration 100 rupees and nominal fee that has been changed to 100 rupees. Only for the first time, contribution of 30 rupees would be sought by way of registration fee. A transportation cost of rupees 100 per visit, with an overall limit of rupees 1,000 per annum is also additional under this scheme. All the beneficiaries belonging to BPL family, APL family, or who are not paying income tax and residing in rural area, municipal corporation area, or notified area, are benefited with the scheme. The other important scheme had been urban slum healthcare project in Andhra Pradesh and Odisha. Another innovative approach that has benefited many people. While the urban health centers were established by the state, their day-to-day management has been contracted out to local service providers, NGOs for profit and non-profit for entities. Urban health centers are located within the slum to ensure PTA access for the target population. This innovation, which was done in Andhra Pradesh and Odisha, this model is now being taken by the government of India. In urban areas, we are getting primary health centers for 50,000 population and community health centers for 2.5 lakhs population. And urban health scheme, urban health is being launched under National Health Mission or as a part of Urban Health Mission. Now, we have discussed some of the innovations, particularly, but there are many other areas of innovations in terms of provision of transport. Say, for example, Janni Suraksha Yojana. We are taking care that, in fact, it has been observed that 50% of the maternal deaths do occur on the way. And in that particular situation, it becomes important that efficient transport mechanism must be provided to them. And when many reforms have taken place in terms of disbursement of money to the beneficiaries, in terms of providing transport facilities, in terms of enhancing financial protection by providing insurance, and also working involvement of private sector, involvement of practitioners, and also working on the public-private partnership mode. The point which is important that if we are want to work on public-private partnership mode, we have to be conscious of the fact that public sector is not going to be replaced by private sector. The role of private sector will be of a supplementary or complementary in nature, and in terms of provision of human resource, in terms of provision of services, in terms of optimizing the benefit of a particular system. If a particular public health enterprise is not having a particular expertise, that can be the services of private sector can be hired for that particular purpose, and in that way, in that complementary manner, we can enhance the credibility of the institution, we can enhance the service provision or entitlements of the service provision to the masses. Just to summarize, that innovations can be of several types, and probably no system can grow without the taking initiatives for innovations. Innovations, if one is trying for innovations, it might fail also. But the thing is that we have to innovate in order to have better dividends. As I said, at the end, would like to define again what innovation is. Innovation is often defined as the introduction and application of ideas, products, services, processes, and technologies. Innovations can be not only in terms of a new drug, it can be an idea, it could be a product, it could be a service, it can be a process or technology, which are either new, they may be new, entirely new concept, or they may be improvements of the current system that benefits individuals, a group of the society as a whole. It comprises of some of the major innovations comprises of telemedicine, health management information system, social health insurance schemes, and various public-private partnership reforms and initiatives, mobile health services, etc., that aim to improve the health of the population as a whole. Finally, I must thank you for visiting PG Pathshala.